responsible for plantar flexion of the ankle joint? Option A, tibialis anterior. Option B, gastrocnemius. Option C, soleus. Option D, peroneus longus. And the answer is option B, gastrocnemius. I would like to clarify that option C, soleus, is also the correct answer. In an MCQ exam point of view, we need to choose one answer. So we chose the correct answer will be gastrocnemius. Let's move to question number 162. What is the primary mechanism of injury in an anterior cruciate ligament tear? Option A, direct trauma to the knee. Option B, excessive knee extension. Option C, non-contact deceleration with a planted foot. Option D, hyperflexion of the knee joint. And the answer is option C, non-contact deceleration with planted foot. That's plantar flexed foot. Now let's move to question number 163. Which of the following exercises is recommended for strengthening the rotator cuff muscles? Option A, dumbbell bench press. Option B, seated cable row. Option C, lateral raises. Option D, external rotation with resistance band. And the answer is option D, external rotation with resistance band. Now let's move to question number 164. What is the primary function of biceps femoris muscle? Option A, hip flexion. Option B, knee extension. Option C, hip extension and knee flexion. Option D, knee internal rotation. And the answer is option C, hip extension and knee flexion. Now let's move to question number 165. Which of the following muscle is primarily responsible for internal rotation of the shoulder joint? Option A, infraspinatus. Option B, subscapularis. Option C, teres minor. Option D, pectoralis major. And the answer is option B, subscapularis. Now let's move to question number 166. What is the recommended initial treatment for a grade 2 moderate ankle sprain? Option A, immobilization and weight bearing as tolerated. Option B, rise, rest, ice, compression, elevation and non-weight bearing. Option C, immediate surgical intervention. Option D, aggressive rehabilitation exercises. And the answer is option B, rise and non-weight bearing. Now let's move to question number 167. Which of the following exercise is recommended for improving dynamic stability and proprioception in athletes? Option A, seated dumbbell curls. Option B, single leg squat on Bosu ball. Option C, leg press machine. Option D, bench press. And the answer is option B, single leg squat on Bosu ball. Now let's move to question number 168. What is the primary mechanism of injury in hamstring strain? Option A, eccentric overload during sprinting or kicking. Option B, direct trauma to posterior thigh. Option C, excessive knee flexion with hip extension. Option D, repetitive overuse without proper recovery. And the answer is option A, eccentric overload during sprinting or kicking. Now let's move to question number 169. Which of the following condition is characterized by the pain and tenderness around the lateral epicondyle of the elbow? Option A, biceps tendinitis. Option B, rotator cuff impingement. Option C, tennis elbow, that's lateral epicondylitis. Option D, patellar tendinopathy. And the answer is option C, tennis elbow. Now let's move to question number 170. What is the recommended treatment for a grade 3, that's complete tear of medial collateral ligament, that's MCL of the knee? Option A, immobilization and non-weight bearing. Option B, rise and weight bearing as tolerated. Option C, surgical repair followed by rehabilitation. Option D, aggressive rehabilitation exercises without surgical intervention. And the answer is option C, surgical repair followed by rehabilitation. Now let's move to question number 171. Which of the following exercises is recommended for improving core stability and trunk control in athletes? Option A, biceps curl. Option B, leg extension. Option C, plank. Option D, seated cable rows. And the answer is option C, planks. Now let's move to question number 172. What is the primary mechanism of injury in a groin strain? Option A, direct trauma to the groin area. Option B, excessive hip abduction and external rotation. Option C, sudden acceleration or change of direction with adductor eccentric overload. Option D, repetitive overuse without proper recovery. And the answer is option C, sudden acceleration or change of direction with adductor eccentric overload. Now let's move to question number 173. Which of the following condition is characterized by the pain and tenderness around the inferior pole of the patella? Option A, patellar tendinopathy. Option B, iliotibial band syndrome. Option C, Osgood-Schlatter disease. Option D, chondromalacia patellae. And the answer is option A, patellar tendinopathy. Now let's move to question number 174. Which of the following muscle is primarily responsible for external rotation of the hip joint? Option A, gluteus medius. Option B, gluteus maximus. Option C, piriformis. Option D, iliopsoas. And the answer is option C, piriformis. Now let's move to question number 175. What is the recommended treatment for a complete rupture of Achilles tendon? Option A, immobilization and non-weight bearing. Option B, aggressive rehabilitation exercises. Option C, surgical repair followed by rehabilitation. Option D, rise and weight bearing as tolerated. And the answer is option C, surgical repair followed by rehabilitation. Now let's move to question number 176. Which of the following exercise is recommended for improving proprioception and balance in athlete? Option A, seated dumbbell press. Option B, leg press machine. Option C, single leg balance board exercise on Bosu ball. Option D, barbell squats. And the answer is option C, single leg balance exercise on Bosu ball. Now let's move to question number 177. What is the primary mechanism of injury in rotator cuff tear? Option A, direct trauma to the shoulder. Option B, repetitive overhead activity with impingement. Option C, sudden deceleration with eccentric overload. Option D, excessive external rotation of the shoulder. And the answer is option B, repetitive overhead activities with impingement. Now let's move to question number 178. Which of the following condition is characterized by the pain and tenderness around the medial epicondyle of the elbow? Option A, golfer's elbow. Option B, tennis elbow. Option C, biceps tendinitis. Option D, rotator cuff impingement. And the answer is option A, golfer's elbow. Now let's move to question number 179. Which of the following muscle is primarily responsible for internal rotation of the hip joint? Option A, gluteus medius. Option B, gluteus minimus. Option C, tensor fascia lata. Option D, iliopsoas. And the answer is option B, gluteus minimus. Now let's move to question number 180. What is the recommended treatment for grade 2 moderate pain of the acromioclavicular AC joint? That's acromioclavicular joint. Option A, immobilization and non-weight bearing. Option B, rise protocol and activity modification. Option C, immediate surgical intervention. Option D, aggressive rehabilitation exercises. And the answer is option B, rise and activity modification.